Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our biweekly update on the coronavirus pandemic in the country, in Maryland, and here at GBMC. So you've seen a lot on the news about the Delta variant, and this variant is clearly easier to transmit from one human to another than the previous variants that we have been confronting in the United States and in Maryland. So today, we are back up to 337 people in Maryland hospitals. Those are people who have contracted the coronavirus, most of them the Delta variant, and they have gotten sick enough to require hospitalization. Now, the percentage of those who are in the ICU is still fairly low, but we do have people sick enough to be in the intensive care unit. We are now seeing some patients who have been immunized who are sick enough to make it into the hospital, but they are still a smaller percentage of the total. The majority continue to be people who have not been vaccinated. If you think about it, we were hopeful that the vaccines would be 75% effective. We now believe that they're significantly more effective than that, but even if they got as high as 95% effective, there would still be 5% of people who are not going to get all the protection from the vaccine. We also know that people can be infected with the virus after they've been vaccinated and not be sick at all, but be continuing to carry the virus in their nose, thereby making it easy to transmit if they sneeze or cough, or even if they're speaking at close contact with others. And this is the reason why we are discussing the use of masks again for gatherings indoors. For a number of months now, we've told people if you have been vaccinated, you do not need to wear a mask indoors. Now, it's better if you are indoors in a gathering of people, especially if you're not sure if they've all been vaccinated, to wear a mask. Why? Because the mask will stop most of the transmission of the virus if you are carrying it to others. How about this situation at GBMC? Right now, we have 7 people at GBMC who are COVID-19 positive, and 3 of those people have had at least 1 dose of a vaccine. We are seeing the same pattern as is being seen in the rest of the country. On average, people who have been immunized are less sick even when they're sick enough to be in the hospital. You may have heard on the news that in the United States of America, during the month of June, 99.2% of those who died from the coronavirus had not been immunized. So the message continues to be, let's get everyone immunized. Let's talk a bit about the science of the vaccines. The vaccine presents to the human body antigen, and that antigen triggers in the human a response. And that response is to make antibodies that will then attack the virus if you get infected. The immunization itself cannot create the disease, and the immunization itself is not likely to create any significant side effect. As we all know, the triggering of the immune response in some people when they get either the first dose or the second dose of the vaccine does cause them to get, some people to get some symptoms. Generally, the symptoms are low-grade fever, which is part of the immune response, feeling tired, muscle aches and pains. Those symptoms go away generally within 24 hours. It is very, very, very rare that anyone gets a significant side effect of the vaccine. So people continuing to believe that the risk of the vaccine is worse than the risk of contracting the virus and getting sick or even dying, that is unreasonable. Let me give you a statistic to underline how unreasonable that is. The American Medical Association has now reported that 96% of physicians have been immunized. Think about that for a moment. These are the people who are most versed in the science of medicine and the people best educated about immunizations. If in fact the immunization was riskier than the disease, why would 96% of physicians take the vaccine? We scientists continue to believe that these people that believe that the vaccine is more dangerous than the disease are dramatically poorly informed. We must stand united. We are a country based on scientific principles and logic. And again, the only way to get out of this pandemic is for us to stand united and live by the science. Let's get out there and help the people who have not been vaccinated yet move towards vaccination. So again, let me thank you all for everything that you're doing to keep yourself and your friends, neighbors, and colleagues safe. Let me thank the healthcare workers who are very concerned about another significant surge. The rates of disease are going back up. In Maryland, we're above 3% test positivity. We don't want to get back to 5%. Please use your mask when you should. Wash your hands. Be safe.